So Jill, would you be prepared then to give us 60 seconds of CPD on what a client should expect when they go to the vet as regards antibiotics?
Yeah, let's go for it.
Fantastic. Okay, let me get the clock ready then. So we've got the clock ready. So this is Jill Moss from the Bella Moss Foundation talking about antimicrobials, antibiotics, what to expect when you go to the vet with your pet. Take it away, Jill.
So we know that animals that are healthy and not susceptible to becoming ill, we want to keep them that way. So what we suggest is if your animal does become ill, go to the vet, but make sure that you get the right drug for the right bugs. So cultures are really important and you can find out what bacteria is present. Don't demand antibiotics if they're not necessary. If your vet says no, then listen to your vet. If your vet does prescribe antibiotics, make sure you take the whole course and don't finish it halfway through. Antibiotics need to be completed. But at the end of the day, you want to get the right drug for the right bug and keep your animals healthy by not over-prescribing antibiotics and not asking for them when they're not necessary.
We've got time for questions.
Question time. So what you're talking there, Jill, is about compliance and concordance, aren't you? So clients need to know that if they're given a course of antibiotics, they need to be able to give it to their pet, and they need to be able to give it to their pet for the entire length of the course.
Yes.
We're out. That was fantastic.
There we
60
go.
seconds. That was done brilliant. Thank you so much. That was 60 seconds of CPD with question times. Brilliant.
And that's the first time we've ever had question time in a 60-second CPD as well.
It is. That's amazing. But actually, it does highlight a problem, doesn't it? Because quite often clients will come to me and say the ear infection's back, and I'll say, what ear infection? The one he had 3 years ago. Yes. Okay. Well, we need to get a culture. Okay.
Yeah.
I did give someone a little pink antibiotics that you gave him last time. I had a few left.
Yes, I hear this a lot. I hear it. I'm on the phone a lot with owners that are more or less dragging things out of the cupboard that have been there for a few years and not necessarily prescribed for their actual pet. It's a little bit of worry. Yeah,
it is. But sometimes you drill down and say, why didn't you finish the course? And actually, the reason is usually either it got better, so I thought it didn't need it, even though in your mind you think, well, I think I drummed in that they should finish it even if it gets better. Yeah. But also, the ones I have some sympathy for are, it was so difficult to give it that in the end, I just couldn't bear to give it for the entire course.
That is a real problem. There is there is an issue. I mean, every pet is different. Every species is different. You're not always going to get the antibiotic in easily. But, that I think owners have to understand that somehow or another, unless the animal is so ill and not eating, then it's very difficult.
This is where International Cat Care have come in with their easy to give stuff as well.
Yes.
Because, cats are a nightmare to dose, aren't they? All cats are a nightmare to dose. And so things that are palatable make life much easier. But you talk about finishing courses. Interesting. The guidelines have changed a bit on that, haven't they, over the years? It's now give as long as is necessary rather than necessarily a complete course.
It is, and the length of courses have changed as well.
We're going to have to do that 60 seconds again then.
No.
Because I didn't say that.
well, no, you did, because you said give the course that the vet has told you. So the vet is then responsible for saying that there are 10 antibiotic tablets here, which is a 5-day course. If, however, you feel that the pet is well enough at the end of 3 days, bring it back. Yeah, we'll have a look and we'll discuss together. Well,
that's why
what the next stage is.
Transparency is so important, and I think the relationship that you build up between a client and a vet is very important. If you've got that open communication, then that's the best you can have for a pet's health at the end of the day.
It is.